Okay, well, there's been lots of talk about, like the longevity science. How can we all live healthier for longer? That's been a bit of an old bugbear. AI, we know this is an old hobby horse as well.
Good afternoon and welcome to this week's edition of A Closer Look, where we take you behind some of the biggest stories that the National's been covering. Arab Health is running throughout this week in Dubai, and it gives a glimpse of the healthcare industry as it may be in the future. Artificial intelligence and smart healthcare are big themes. This week we're going to take a look at those. Our health editor Nick Webster has been covering Arab Health for 10 years now, and here he is to join us. Nick, without further ado, do you want to tell us a bit about what healthcare might look like in the future?
Sure, I mean, this event is huge. I mean, the entire medical world descends on Dubai, it seems, for 4 days, 49th edition, so it seems to get bigger and bigger every year. This year there was a huge focus on automated service robots, if you like. We've seen them in other industries like agriculture, logistics, transport, but not really in healthcare. And this was kind of the first time we've seen them introduced into hospitals.
We've seen Taliban delivering your takeaways
Exactly.
at Expo, but not yet in hospital wards.
Yeah, I mean, obviously there's some unique challenges presented by getting these robots into hospitals. How do they deal with lots of busy wards, people doing their jobs day to day? And of course, hospitals are unique environments. Sterility is very important. And we saw just how these robots could be helping day-to-day labour services, helping out people who are working on the wards to deliver meals, surgical devices, taking away laundry, all these kind of things. And it's an interesting sort of development in the way these robots are going to be used.
So there's been a lot of talk of like how far has artificial intelligence got. So these robots aren't doctors. They can be programmed to do certain tasks. Is that right?
That's right, yeah. We were told that these particular robots by the Singaporean robotic company called Otsaw could take on the role of 3 members of staff, if you like. 8-hour battery life, and as long as you've got a hospital with automatic doors, with lifts obviously and ramps, that it can get around pretty easily, and they can work outdoors as well. So if you've got hospitals and separate different blocks, they can cope very well with that kind of terrain. So,
but these are delivering meals, giving injections, but the serious work of diagnostics is still, thankfully, with a human for now.
It is, yeah. This is still called mission critical operations, though. I mean, if patients don't get fed on time, don't get their hot meals, they don't recover, they don't leave the hospital ward. So they still create a very important role they're filling. But yeah, you're quite right. The diagnostics is the next big step, really, in healthcare. And we saw some big advances at Arab Health in magnetic resonance imaging. You might have seen in the US how this has become almost like a wellness accompaniment now for people to get their bodies checked out, the full imaging inside, to see how how healthy they are and how they can manage their lifestyle to live longer, I guess. Longevity science was also a big part of Arab Health.
So I wanted to ask you about this because we were talking about it before Arab Health started. This Life Scan is one of the brands I've seen made popular by Kim Kardashian. So I don't want to lower the tone of the debate, but it's become popular because celebrities are going into hospitals to have everything scanned to live as long as possible. I mean, can you tell us how viable this is? Can ordinary people like you and I be going in for a full MRI, or is this something that's still out of reach for many of us?
Well, MRI's been around for a generation, since the 1970s, but the technology's getting better. That's the crux here. I mean, these huge machines have these huge superconductor magnets, and they're cooled down with liquid helium, which is very expensive and very hard to get hold of. So you need this huge infrastructure around these huge scanners, but companies are making these machines smaller now. So rather than having to have 1,500 litres of liquid, you can do it with less than a litre. So
you can scan more people per day.
You can scan more people. And it's not just about getting into the wellness and lifestyle markets. You can get these scanners out into rural areas or smaller villages and towns rather than the big cities and the big hospitals where we see these scanners typically. So it is expanding this area of diagnostic technology, which means more people can get checked earlier for things like cancer, cardiovascular disease, and all kinds of other health anomalies which need to be picked up early to get the right treatment.
How expensive is it were I to pay for a scan that would potentially detect something I wouldn't know about otherwise? Okay,
well, doctors here are recommending at the moment that you shouldn't really get these scans if you're well and you're healthy. But in the US, private companies are charging around $2,500 for a full body scan. And again, I'm not doing for an MRI at all in your life or any of your friends have, but it's not a particularly uncomfortable experience. You're inside these very small contained tubes, can be quite claustrophobic, and the scans can last for about 40 minutes. So it's quite an uncomfortable experience. Now these new machines, although the magnets are smaller, the actual patient experience is better. It's a bigger sort of area for you to lie down into. It's not quite as claustrophobic. So the patient experience is getting a bit better as well. But again, doctors here are saying it's still some way away from having it in hospitals in the UAE just to have your wellness checked. And whether insurance will pay for it as well or not, I'm not too sure.
So I'm going to ask you to look into your crystal ball. Since you've covered 15 years of Arab Health.
10 years.
Sorry, what sort of advances are we going to be seeing in the next couple of years from everything you've glimpsed this week?
Okay, well, there's been lots of talk about, like the longevity science. How can we all live healthier for longer? That's been a bit of an old bugbear. AI, we know this is an old hobby horse as well. I think automation in hospitals is definitely going to be more commonplace. We've seen this week robots taking blood samples, for example, at Arab Health. We've seen brain scanners coming in, which are more portable as well. And just generally robots assisting with the day-to-day task of running a hospital, whether it's moving patients around or lifting heavy machinery, for example. We are going to see more of that in hospitals, and that's relatively new. Like I said, lots of industries already had this, hospitals not so much, so we're going to see more of that in the future.
I think that's the thing with AI, like it's been talked about for so many years, but we're starting to get to the point where you actually start to see it in offices, companies, hospitals, sort of everything around us. So definitely an interesting subject to be covering.
Yeah, I mean, these full body scans, they get 11,000 images. So to have one or two doctors going through those takes a lot of time. If that can be done by AI, you get the results much quicker, and you will still need the human expertise, of course, but AI can certainly help get through the huge amount of data that's being processed by these scanners.
Fantastic. Nick, we'll leave it there. Thank you very much indeed for joining us. Well, that's all we have time for this week. Thank you very much for joining us. If you want to read more about MRI full body scanners and the artificial intelligence doctors of the future, head over to our website at thenationalnews.com. Thank you and see you next week.